4 years ago, I graduated from University of New Mexico, and I came back to Washington State because that's where all my family is. And I applied here at Memorial for the residency program. I always knew that I wanted to do wound care, just was never able to get into those classes during my bachelor's program. So when I was in the residency program, I shadowed the wound care nurses here at Memorial, and there was a opening for a clinic position here at Memorial, and so I applied, and they hired me, and that is where my journey started in wound care. Um, and so just about back in the first part of the year, my manager was trying to get me certified so that I can work independently up on the floor when they need me. And so that is where they were doing some research, and the union said that there was this class that I could take to get certified. And that's where I'm at. So I've never been with a union before. This is my first union, and so I didn't know anything about the training fund. My boss used to be a floor nurse and was telling me about it, and so that is how I came to find out about the union and the training fund. And so that helped me to be able to get in because I'm a single mom with a child who's very ill and been in and out of the hospitals. And so I haven't been able to, I wouldn't have been able to do this class or anything on my own. So the training fund has supported me through helping me pay a couple bills so that I could take time to do my preceptorship. I start that in 2 weeks for the classes. But if it wasn't for the training fund, which I'm so grateful for, I would have never been able to further my career and get more knowledge on wound care and ostomies. So I'll do my preceptorship the first week of December, and the third week of December I do have to go over to Tacoma and Auburn area to do it because um what is it? The WOCN nurses here. They're not WOCN certified to do my preceptorship here. So I'll be going over there and doing that. And hopefully I'll be able to do the test in January or February for certification. And then after that, that will give me the ability to help the girls out on the floor. We have 2 wound care nurses on the floor right now, but it'll make it so that I can work independently up there of them, and also so that we can see more ostomy patients in the clinic. We're trying to start up an ostomy clinic where 1 day a week we see just ostomy patients. And so with my certification, that will help me to be able to do that while alleviating the girls upstairs from having to come down and do that because they have to take time out of their day to come down every time we have an ostomy patient. I will say that the teachers were wonderful. I loved working with the teachers through San Jose College. They were amazing. Along with Sinitra, she was amazing. Every time I reached out to her because I had a question, she was on top of it. If she didn't have the answer, she would find the person. But everybody has been so great and very helpful when there has been any questions come up around. Oh, I'm just glad that you guys have this resource, and I hope that you guys are able to continue to help other nurses achieve their goals as well. Well, I appreciate all of you guys and all that you've done. I know that I couldn't have done it without you guys.